Hello again, this is Dr. Ty Vincent with an LDI-based topic, this time regarding a pretty debilitating, horrible condition called interstitial cystitis. This is predominantly seen in women. Occasionally there's a man that'll develop it, but it's mostly a female condition that you get, and it's often coexistent with endometriosis. I just did a video about endometriosis as well. Many of you women out there who have either one of these conditions will also have the other or have had it at some point in your story. A lot of the women I talked to with interstitial cystitis had endometriosis at some point in the past, and maybe it kind of stopped being a clinical problem for them. And there could have been a relay race sort of handoff. I had endometriosis when I was younger, and I had infertility problems and menstrual issues, and then that kind of got better, and I developed interstitial cystitis instead. And so there can be a continuum, or they can exist together if you're really unlucky. And it's really pretty miserable. So interstitial cystitis, if you have the condition, you know all about what it feels like and what it's like. For those of you who don't, it feels like you have a bladder infection all the time. And yet when you go to the doctor and you leave a urinalysis and culture, nothing grows. You might have evidence of inflammation. There could be blood in your urine. There could be white blood cells in your urine, things like that. But nothing grows on the culture. Sometimes that means you have a yeast urinary infection. What you need to know about urine cultures is that they're only looking for bacteria. And the medium that they use to grow the bacteria in that sense doesn't grow yeast. So if you have a yeast UTI, which can lead to interstitial cystitis, I'll get to that in a minute, then you need to ask them to do a yeast culture or to look at it closer under the microscope or something, because it won't show up on the usual bacterial culture. They'll say, well, you don't have an infection. Yeah, actually you do. It's just not the one they were looking for. So, as I mentioned, yeast in that context, a lot of women who have interstitial cystitis, I would say the majority for sure, developed it because they developed yeast sensitivity. So they developed at some point through their history a hypersensitivity reaction to yeast, candida, which lives in everybody. Yeast is the most common LDI antigen I have to use for people that's not an allergy, something that's a microorganism in the body. Yeast sensitivity is more common than any other thing. And it's because it's abundant in everybody normally. And certain common human behaviors in the modern era predispose to a greater abundance of yeast in the GI tract and the genital urinary tract, which leads to eventually in some of us an immune hyperreactivity state against that yeast because it's just been there too much and we can't tolerate it anymore, literally. So having antibiotics a lot in the past, women who had acne in their teens and took a bunch of antibiotics for it, or if you had recurring sinus infections, ear infections, strep throat, other forms of tonsillitis, or if you just had recurring urinary tract infections that were legitimate urinary infections after intercourse or due to some other thing, then over time you may develop a yeast sensitivity problem, and it may manifest in part as interstitial cystitis. A lot of women with interstitial cystitis will have other yeast-related sort of problems, like irritable bowel syndrome symptoms or SIBO, which is a popular diagnosis nowadays. Those are often associated with yeast intolerance as well. Constipation, gas, bloating, irregularity, abdominal discomfort, that kind of thing. You might get vaginitis a lot. So a lot of women with interstitial cystitis will just have obvious vaginal burning and itching and discharge and pain with intercourse. That almost always indicates a yeast sensitivity. The interstitial cystitis problem itself, with the constant bladder inflammation, can originate as a reaction to one thing, just the yeast perhaps. But as it goes on, you can accumulate other immunological targets and antigens and triggers. So some women I worked with, they also are triggered by specific foods, and they have food sensitivities that manifest as bladder inflammation. So we have to address the food tolerance issue as well in those cases. Some women have developed immune reactivity to different bacterial species that inhabit the urinary tract under normal circumstances. And so we have to desensitize them either using the UTI mixture that I have, which has a collection of a half dozen or so common urinary bacteria, or in some women's cases, if you don't completely resolve your interstitial cystitis with the yeast mixture, the food mixture, the UTI mixture, we end up then next including a autologous urine solution that we make from you. So people are living with some other organisms in their urinary tract that they're reacting to violently, and I need to get a sample of those that might be specific to you and your case. So We use autologous urine LDI, where people mail me a sample of their urine, and then I dilute it and filter it for sterility, and the proteins from the bacteria that were living in there act as the antigen. And in some women's case, that has been the magical thing to add that resolved this for them. So it's not a one-to-one thing like interstitial cystitis equals yeast or something. It's multifactorial in most of you by the time I get a chance to talk to you, because most women have had the disease process for years by that time. But you can unravel this for the vast majority of you, and it's a really debilitating problem. So if you have access to someone with some immunotherapy technique that does LDI or some other form of immunotherapy that might help you reestablish immune tolerance to the stuff growing in your urine, or to the foods that are triggers for it, or yeast, or whatever is the problem, somebody with that skill set, they may be able to fix this for you. And I hope so, because it's a really miserable problem for people to have. Thanks.